For complete study material, WhatsApp now to 971502515717. For more videos, stay tuned to
Nursing MANTHRA YouTube channel.
A nurse has just admitted an elderly patient following a fractured tibia. The patient appears malnourished. To assess the patient for protein deficiency, the nurse should assess which of the following laboratory findings: A. Serum albumin. B. White blood cells. C. Hematocrit. D. Liver enzymes. Which of the following measures best determines that a chest tube is no longer needed for a patient who had a pneumothorax? A. The drainage from the chest tube is minimal. B. Arterial blood gas levels are obtained to ensure proper oxygenation. C. It is removed and the patient is assessed to see if he is breathing adequately. D. Absence of fluctuation in the water seal chamber occurs when no suction is applied. A patient is to receive 5 mg of morphine sulfate. The ampoule contains 10 mg per milliliter. How much morphine should the nurse administer? 2.0 mt. B. 5.0 milliliters. C. 0.5 milliliters. D. 2.5 milliliters. A nurse is caring for a patient in severe pain following an automobile accident. The nurse understands the medication ordered for the patient should be saved until the pain is severe to prevent addiction. A. True. B. False. Which one below is the correct sequence for donning personal protective equipment? A. Gloves, goggles or face shield, gown, mask or respirator, hand hygiene. B. Hand hygiene, gown, mask or respirator, goggles or face shield, gloves. C. Hand hygiene, gloves, goggles or face shield, mask or respirator, gown. D. Gown, mask or respirator, goggles or face shield, gloves, hand hygiene. What type of precaution do you need to apply for patient with Clostridium difficile? A. Standard and contact precautions. B. Standard precautions. C. Standard and airborne precautions. D. Droplet precautions. A nurse is assessing an adult patient for peripheral cyanosis. The nurse should assess the patient's A. Chest. B. Groin. C. Nail beds. D. Sclera. An adult patient on the ward is hyperthermic. The nurse anticipates that the patient will exhibit A. Clot formations. B. Sluggish blood flow. An increased heart rate. D. A subnormal glucose level. A balanced moist wound environment. A. Prevents tissue dehydration and cell death. B. Causes peri-wound maceration. C. Interferes with growth factors. D. Keeps the wound surface cool. Which of the following symptoms of hypertension is most common? A. Blurred vision. B. Epistaxis. C. Headache. D. Peripheral edema. For complete study material, WhatsApp now to 971502515717. For more videos, stay tuned to
Nursing Mantra YouTube channel.